I have an uncle that's in a convalescent home, and I was just visiting him by chance, and he had fallen and lost half the functioning of the right side of his body. And he was just saying, I have a really sore spot, and he's had this denture forever. And I was able to look at it. I'm like, let me see if I can do something for you. And of course, I didn't have any equipment, but I just ran over to the Home Depot, grabbed myself a little Dremel tool, was able to adjust it, and I made him comfortable. And we couldn't feed him fast enough. And those things really kind of think, wow, I can make a difference. I can improve the quality of life. And in that case, I knew I extended his life because he can eat. And, when nothing else is working, he couldn't move half his body, but, he was able to at least have that moment of joy of eating, and those little things, I think, make you feel good to be a dentist. General dentists can technically do everything, as long as they do everything by the standard of care. So if I were to do a certain procedure, I have to do it as well as a specialist. The main specialties are oral surgeon, periodontist, pediatric dentist, endodontist. There's preventive dentistry or public health dentistry. The oral surgeons mainly do the oral surgeons do extractions. They also do facial restructuring too. So if you have a patient who, let's say, got into a car accident and they had a lot of trauma to their jaw, an oral surgeon would not only put the jaw back into position, but if there's a fracture in the jaw, they would be able to put plates to stabilize it. Okay, so an oral surgeon can do a lot. They first go to dental school, and then they also go get their medical degree too, and then to do their residency in oral surgery. A periodontist, what they do is they really focus on the health of the gums and the bone, and the aesthetics of the gum tissue. So periodontal disease is a chronic inflammatory disease that affects your gums and your tissue where you have bone loss. So what a periodontist can do is disinfect the area, try to regenerate bone so that they can save the tooth. And there's implants. Both oral surgeons and the periodontists can place implants, which is basically a screw that they put in your bone once you lose a tooth that will allow it to have an anchor so you can put a false tooth on that. An endodontist is someone who does root canals. Now, a root canal is basically a tooth that has become inflamed and has a bacteria infection within the tooth, and then that infection can only be removed by removing the nerve and the blood vessels in that tooth. And so that specialty will disinfect the tooth itself, all the nerve tissue, and then try to preserve that tooth. Okay. An orthodontist is someone who looks at malocclusion. If you have crowding, your teeth are crowded, repositioning your jaw. Some people have underbite or their jaw is too forward or too back. And so they deal with a lot of skeletal facial profiles and tooth alignment. And some of them also treat the joint. You see people have they say they have TMD or TMJ problems, meaning that they have a lot of pain in their joints. And so they address a lot of that, aesthetics and alignment of the teeth. Pediatrics are mainly dentists that deal with kids. And so they have the specialty of having to treat young children who might not be able to cooperate in the chair, meaning that they're just too anxious, too apprehensive. So a lot of the pediatric dentists, they have their office really cater to children. So there's not that, they make it fun. And they also provide ways to sedate the patient and just overall manage children and their dental needs. So I had a patient come in. She's an 81-year-old Japanese lady, really sweet lady. She came in so I can, I think, deliver her crown. And then she was just telling me on the sideline that she lost one of her hearing aids. And she's like, oh, well, I'll just wait. And, it's no big deal. I still have one good ear to listen. And so I'm like, when did you lose it? She's like, oh, when I took off my mask, I think I dropped it at Target or something like that. I'm like, no, you dropped it in your car. I know you dropped it in your car. And she was like, no, I looked in my car. I'm like, no, just give me your keys. Give me your keys and let me go find it, right? She's like, no, you're busy. I'm like, I'm not busy enough. This is a quest. I need to solve this situation, right? Because, she can't hear. And so I took her car keys. She's like, oh, it's so messy. I'm like, don't worry about it. My car's messy. So I went out there and literally I looked at, in between, the middle console, and right at the bottom of her mat, I see the little earplug. And so I pulled it out and I brought it in, and she was so happy. So happy. And it doesn't have to be necessarily with dentistry, but those are like the challenges that people go through every day, just living. And, just knowing that you can be useful and helpful, that's how I solved that one. And that was a lot of fun. That was one of my, I would say, highlights of this year, her and my uncle. One of the hardest parts of being a dentist is the physical aspect of it. Like I said, it's very labor intensive. Sometimes you see a lot of the elderly patients, they can't be leaned all the way back. And so you're always having to hold a really awkward angle. And that puts a lot of strain in your neck and your back. And then you're working in, a 4 to 5 millimeters space and trying to keep everything nice and dry. That's a really hard labor-intensive job, more than I ever thought it would be. And the cost of everything, the materials, the equipment, it's a huge investment. And you got to make sure everybody gets paid. So that's also a stressor, too. And so it's definitely not an easy job. Dentistry itself is easy, but managing the overhead of operating and the staff to operate, that's the hard part. I think really great dentists have really good artistic skills. Like if you're just talking about pure dentistry, you got to have good hand-eye coordination, and the really good ones really listen to what the patient needs, and they're very good at articulating what needs to be done and explaining it in a way where the patient can understand the process, trust the process, and then trust you. And the really great ones can combine all that together, be able to articulate the science behind it, articulate the process, the expectation, and then to also keep the patient calm and be able to work in a fast way. Too, which I'm working on. I'm quite slow, but I try to be fast as I can. I think most universities right now require that you have an undergraduate degree. Doesn't necessarily mean they have to be a science background, but you have to have a bachelor's of science or a bachelor of arts degree. So 4-year college. You have to take the DAT, and then you do 4 years of, there's different programs, but majority of them are between 3 to 4 years of dental school. And then if you decide to do a specialty like orthodontics, periodontics, you have to do the GRE, which is kind of odd, but they do require you to take the GRE, and then you apply for your specialty program. The best advice I would give to a dental student is to actually become active duty. It is scary to work, to be potentially deployed, but they take care of so much of the financial burden of paying for your education. And, when my husband was active duty, but he didn't want me to go for the active duty scholarships because there was a really high chance of both of us being deployed. My boss, who I worked for, Dr. Miller, she was active duty, and so all of her education was taken care of. She didn't have to worry about already being in debt when she left school. So I would definitely recommend a dental student to try to have that debt taken care of by, join one of the armed services. And you get great opportunities to travel and to go into a residency program if you wanted to become a specialist. And I think it's a good deal. It's scary because you are putting your life in harm's way, but you'll be set up better financially if you have your education taken care of, the debt of it anyways. A typical job for a recent graduate is working for a corporate dental office. So like your Western Dentals, your Eyebright, or your, I think it's called PCS, one of those dental corporations. So you can see a lot of dentists going in there and, getting their speed up to learn to work a little fast, how to diagnose, work with assistants. So I see a lot of recent graduates going that route, or, again, joining the services. Or there's also something called a locum dentist, which I got to do a little bit, which pretty much you work as a temp dentist. And that's a nice way to kind of get your feeling for the office too, without fully committing to working for that particular practice. Again, everybody runs a dental practice different, and there's different personalities. But to answer your question, most recent graduates will go work for somebody or be active duty. What I love about dentistry is being able to take care of people. You have to have 3 H's. A good head to get through the academics. Good hands so that you can take care of the patients the way you want to. And you have to have a really, really good heart, because that's what's going to keep you there or showing up every day. If you're missing one of those elements, then it might not be the right occupation for you. And some days you might be missing it, but it'll come back.